Welcome to Marc Wortmann, Executive Director for Alzheimer's Disease International. Marc, thanks for joining us. Early interventions are crucial in the fight against Alzheimer's disease. Only 1 out of 4 people receive such treatments, however. Can you explain to me what are some of the biggest barriers that hinder appropriate diagnosis?
I think there are 2 of them. One is the fact that many people don't understand the disease, so they don't recognize the first signs. This is more in lower and middle income countries, I think. But the other barrier, and that's really a sad one, is that a lot of doctors think that they have nothing to offer. So why should they make a diagnosis? But that's not true, because there are, as our report showed that I cited today, there are interventions and they work, both the medication and the non-medical interventions. So it's a missed opportunity if people are not diagnosed.
Is better and earlier diagnosis for Alzheimer's expensive?
Well, it depends. If it's a clear situation and even a GP could do a diagnosis, and then it's not expensive, of course. If it's a more complicated case and you want to go through the whole process of imaging the brain, neuropsychological test, blood test, etc., then I think it's quite expensive. But even in that situation, it's still worth doing it, because you can help people afterwards, and we've made some calculations that it saves cost in the end to the health system if people are diagnosed earlier.
Earlier today at the forum, you explained that the number of people in low and middle income countries with Alzheimer's is expected to rise exponentially over the next 4 decades. What can be done to reverse these trends?
Well, the best that can be done is finding a cure. Your members are working hard on that. There is a lot in the pipeline. A second important topic is prevention, or I should say risk reduction. We cannot prevent Alzheimer's and dementia, but we can lower the risks by basically living a healthy life. So the same risk factors account for Alzheimer's as for diabetes and cardiovascular diseases, like smoking, physical exercise, keep control of your blood pressure, healthy diet, etc.
What can industry do to help fight against Alzheimer's disease?
Well, continue to investigate new ways, using new technology. Hopefully, I think genes can play a role, because there are more and more genes identified that may have an impact on the disease. And I think we need to find ways with each other, with the regulators and the industry, and maybe the patient organizations, to look for new approaches, because it's not one single disease with one single cause. It's more complicated. It may be, it's called a syndrome, so it's a variety of things happening in the brain that together make the disease happen. So there's probably not one single solution.
Why are the worldwide costs of dementia so high?
It's not because of the medical costs, but it's because of the cost of long-term care. So in the higher income countries, like here in Switzerland or United States, people who use institutions, it's very expensive, because they need care 24/7, and it can go up to $50,000 a year per person. And the other factor is the informal care. It's not a budget line in any budget document, but people who have families with Alzheimer's spend a lot of time in caring for them. And if you calculate that time, what they could have earned when they were still having a job, then it's a major cost.